Hello, my name is Caitlin Newen and my genetic disorder project is phenylketonuria. Phenylketonuria, also known as PKU, is a rare inherited disorder that results in the absence of an enzyme used to break down phenylalanine. Phenylalanine is an amino acid that is found in all proteins and in some artificial sweeteners. Over time, this can cause dangerously high concentrations in the body, in which can lead to major health issues. For example, in a normal patient, they have the enzyme phenylalanine hydroxylase, in which it breaks down phenylalanine into tyrosine. Although in a PKU patient, they're missing this enzyme, in which phenylalanine is then built up in the body. This is caused by a genetic mutation on chromosome 12 on the PAH gene that causes the absence of this enzyme. The gene is inherited by the parents and is also recessive. For example, in this Punnett square, it shows two heterozygous parents. Uppercase P will be representing normal traits, and lowercase p will be representing PKU traits. 75% of the offspring would be normal, although 50% of them would be carriers, which means, just like their parents, they would have a normal gene and a PKU gene. And then they would have a 25% of their offspring actually having PKU. Some symptoms and effects of PKU are tremors, shaking, eczema, which is dry skin rashes, slow stunted growth, abnormally small head, behavioral, mental, and social problems, hyperactive, severe mental disabilities, lack of pigmentation, and foul odor, breath, and urine due to the accumulation of phenylalanine in the body. About 1 out of 15,000 patients in the U.S. are diagnosed with PKU every year. It's common in Northern European and Native American heritages. It's most common in Turkey, with 1 out of 2,600 people having PKU. It's least common in Japan, with nearly lower than 1 in 200,000 people having PKU. There is no cure, but treatments are special dieting or formulas. This means that the diets include no phenylalanine. PKU does not decrease the life expectancy even with or without treatment, although it still causes brain damage. Many PKU patients can live an active and healthy life with or without treatment. PKU occurs equally in male and females. In rare occurrences, PKU has developed during adulthood. For the U.S., infants at birth are usually blood tested in all 50 states for PKU and other diseases. Breastfeeding is encouraged at appropriate age. This is due because breastfeeding has the least amount of phenylalanine compared to any formulas on the market. In this photo, it shows how two siblings get the treatment. Both of them have PKU, but the girl has the treatment and the boy doesn't. They both are healthy. This is my works cited page.